2 days. That's all the warning you get. 48 hours before your kidneys shut down, your body sends you signals. Most people ignore them. They think it's just fatigue, maybe the flu, maybe they ate something bad, and then they collapse. I'm going to tell you exactly what happened to a 67-year-old woman named Margaret. She was healthy, active, took care of her grandkids, and on a Tuesday morning, she woke up feeling tired, a little nauseous, nothing crazy. She thought maybe she caught something from the kids. Wednesday, still tired, didn't eat much. Her husband asked if she was okay. She said, "I'm fine, just a bug." Thursday morning, 6:47 a.m., she collapsed in her kitchen making coffee. Her husband called 911. When the paramedics got there, her blood pressure was 180 over 110. Her legs were swollen. Her breathing was shallow. And when they rushed her to the ER and ran the blood work, the doctor came in and said 5 words that changed her life forever. "Your kidneys are shutting down." She looked at him confused. She said, "But I just have the flu." He shook his head. "Mrs. Patterson, your kidneys have been failing for at least 48 hours. Your body was trying to tell you. You just didn't know what to look for." That's what this video is about, because kidney failure doesn't announce itself. It doesn't come with sirens and flashing lights. It comes disguised as everyday discomfort. And if you're over 50, if you have diabetes, high blood pressure, or you take medications regularly, you need to know the language your kidneys speak when they're dying. Because Margaret's kidneys were screaming at her for 2 full days, and she had no idea. My name is Dr. Jonathan Hayes. I've been a nephrologist for over 20 years. I've sat across from hundreds of patients in the ER who said the exact same thing Margaret said. I thought it was nothing. But here's the truth. Kidney failure is never nothing, and it's never sudden. Your body always warns you. The problem is the warnings look so ordinary that you dismiss them. In the next 25 minutes, I'm going to walk you through the 8 warning signs your body gives you in that 48-hour window before your kidneys begin to fail. Some of these will sound familiar, some will surprise you, and some might be happening to you right now. Let's start with the one that almost everyone ignores. Margaret told me she felt tired, but not normal tired. She said, "It felt like my bones were tired." You know that feeling? When you wake up after 8 hours of sleep and you're somehow more exhausted than when you went to bed? When sitting down feels like a relief and standing back up feels like a chore? That's not normal aging. That's your kidneys struggling to filter toxins from your blood. Here's what's happening inside your body. Your kidneys filter about 200 quarts of blood every single day. They remove waste, balance your fluids, and keep your blood clean. When they start to fail, a toxin called urea builds up in your bloodstream. Think of it like carbon monoxide in a closed room. At first, you don't notice it. But as it accumulates, it poisons everything. Your muscles feel heavy. Your brain feels foggy. Your energy disappears. Clinical studies show that 73% of patients in early kidney failure report this deep, bone-tired fatigue in the 24 to 72 hours before a crisis. But almost none of them connected it to their kidneys. They thought they were just getting old. And here's the thing that makes this even more dangerous. This fatigue usually comes with something else. You lose your appetite. Foods you normally love suddenly don't appeal to you. You feel full after just a few bites. Margaret stopped eating her morning oatmeal. She told her husband she just wasn't hungry. That was her kidney function dropping below 30%. Now let me tell you about Robert, because his story shows you how fast this can spiral. Robert was 61 years old, construction worker his whole life, strong guy, barely ever took a sick day. But one Tuesday afternoon, he told his wife he felt off, tired, a little sick to his stomach. He figured maybe he overdid it at work. It was hot that week. He thought he'd sleep it off. Wednesday, he stayed home from work, slept most of the day. His wife brought him lunch. He took 2 bites and said he wasn't hungry. Thursday morning, she found him in the bathroom, confused, disoriented, struggling to stand up. She called 911. At the hospital, they ran his blood work. His creatinine level was over 8. Normal is under 1.2. His kidneys were in complete failure. The ER doctor asked him, "Did you notice any swelling? Any changes in how much you were urinating? Any pain?" Robert said no, but then he paused. He said, "Well, my ankles were a little puffy, and I guess I wasn't going to the bathroom as much. but I thought maybe I just wasn't drinking enough water. Those were the warnings. His body was screaming at him, and he thought it was nothing. Here's what the doctors found out. Robert had high blood pressure for years. He took his medication most of the time, but not religiously. He also took ibuprofen almost every day for knee pain. And during that hot week at work, he got dehydrated. Each one of those things alone, manageable, all three together, a perfect storm that shut down his kidneys in 48 hours. And the scariest part? He had no idea. Because kidney failure doesn't feel like kidney failure. It feels like being tired. It feels like the flu. It feels like nothing. Let's talk about warning sign number 2. And this is the one people notice, but almost always dismiss. Your urination changes. Maybe you're not going as much as usual. You realize, wait, I haven't been to the bathroom all morning. Or the opposite happens. You're going constantly, but every time you sit down, it's just a tiny amount. The color changes too. Your urine looks dark, almost like tea, or it's foamy, like someone poured soap in the toilet. That foam? That's protein leaking into your urine. It means your kidney's filtering system is breaking down. Doctors call this proteinuria. And when you can see it with your naked eye, when the foam is that obvious, it usually means your kidney function is severely compromised. But here's what people do. They see dark urine and think, I need to drink more water. They see foam and think, that's weird. And then they flush and forget about it. And while they're waiting, while they're dismissing it, their kidneys are dying. Linda was 58. She'd been diabetic for about 10 years, managed it pretty well with medication. One Saturday, she noticed her urine looked dark. She thought, okay, I'm dehydrated. I'll drink more water. She also felt a little bloated, but she'd had Chinese food the night before. Salty. She figured that was it. Sunday, her legs were swollen. Her wedding ring wouldn't come off her finger. She thought, I'll take it easy today. It'll go down. Monday, she woke up and couldn't catch her breath. Just walking to the bathroom left her gasping. Her husband took one look at her and said, we're going to the hospital. In the ER, they did a chest x-ray. Her lungs were full of fluid. Her kidneys were operating at less than 20% capacity. The fluid had nowhere to go, so it was backing up into her lungs. They admitted her immediately, started her on diuretics to pull the fluid off, began emergency dialysis. She stabilized. But the doctor told her, if you'd waited one more day, you'd be on a ventilator. Linda told me later, the signs were all there. I just didn't connect them. And that's the problem. The signs feel unrelated. Fatigue, dark urine, swelling. You don't think kidneys. You think, I'm tired. I'm dehydrated. I ate too much salt. Let me tell you what to look for. If your urine output drops significantly, if you haven't urinated in 6 to 8 hours and you've been drinking fluids, that's a red flag. If your urine is dark brown or cola colored, that's a red flag. If it's foamy and stays foamy, that's a red flag. And if you're seeing these things and you're also feeling exhausted and nauseous, you need to go to the ER. Not tomorrow, not Monday morning, now. Because we're talking about a 48-hour window. And once that window closes, the damage can be irreversible. Warning sign number 3 is swelling, but not the kind of swelling you're thinking of. Your kidneys regulate the fluid in your body. When they start failing, they can't remove excess water. So it builds up, and gravity pulls it down to your ankles and feet first. But here's the thing. The swelling can be so mild that you almost don't notice it. Your shoes feel a little tight at the end of the day. Your socks leave deeper marks than usual. You press your thumb into your ankle and the dent stays there for a few seconds. That's called pitting edema. And when it shows up with fatigue and urination changes, it's a medical emergency. What we see in that 48-hour window is this. Day 1, your ankles are a little puffy. Day 2, the swelling has moved up your legs. Your hands start to swell. Your rings feel tight. In severe cases, your face puffs up, especially around the eyes when you wake up in the morning. This is your body literally holding onto fluid because your kidneys can't process it. Now I know what you're thinking. I get swollen ankles sometimes. Does that mean my kidneys are failing? No, not necessarily. Swelling can happen for lots of reasons. You sat too long on a plane. You ate salty food. It's hot outside. You're on certain medications. But swelling plus fatigue, plus urination changes, that's not a coincidence. That's a pattern. And in medicine, we pay attention to patterns. Let me give you a real world example. There was a man named David. He was 69, retired, loved to garden. One week he noticed his shoes felt tight. He figured maybe his feet were swelling from standing in the garden all day. He didn't think much of it. 2 days later, his wife noticed his face looked puffy. She asked him about it. He said, I don't know, maybe allergies. That night, he woke up short of breath, couldn't lie flat, had to prop himself up with 3 pillows just to breathe. His wife drove him to the ER. By the time they got there, his oxygen levels were dropping. His lungs were full of fluid. His kidneys had stopped filtering. The swelling in his ankles, the puffiness in his face, that was fluid overload. And it had moved into his lungs. They intubated him, put him on a ventilator, started dialysis. He survived, but barely. And the whole time, his body was trying to warn him. Puffy ankles, puffy face, shortness of breath. He just didn't know those signs meant his kidneys were shutting down. Let me pause here and give you something practical, something you can do right now. Press your thumb into the front of your shin, right above your ankle. Press down for 5 seconds, then release. Does the skin bounce right back, or does it stay indented? If it stays indented, that's pitting edema. If you're also feeling tired, if your urination has changed, if you feel nauseous, you need to see a doctor immediately. Warning sign number 4 is nausea. But not normal nausea. Remember that toxin I mentioned earlier, urea? When your kidneys fail, urea builds up to dangerous levels. Your body tries to get rid of it any way it can. One of those ways is through your stomach lining. This causes nausea, constant, low-grade nausea that doesn't go away. Some people describe a metallic taste in their mouth, or an ammonia taste. Food tastes wrong. Even water tastes off. In severe cases, patients start vomiting. And once that starts, dehydration kicks in, which makes the kidney failure even worse. It becomes a vicious cycle. I treated a man named George who came to the ER convinced he had food poisoning. He'd been vomiting for a day and a half, couldn't keep anything down, not even water. We ran his labs. His kidney function had crashed. The vomiting wasn't from bad food, it was uremic toxicity. His body was poisoning itself because his kidneys couldn't filter waste. Turns out George had high blood pressure for years. He took his medication when he remembered, he said. He also took ibuprofen almost daily for back pain. That combination had been slowly damaging his kidneys for months. And when he got a stomach bug and became dehydrated, it pushed his kidneys over the edge. The vomiting wasn't the cause, it was the symptom. His body was trying to expel toxins because his kidneys couldn't. By the time he got to us, his potassium level was 7.2. Normal is 3.5 to 5. Anything over 6 can stop your heart. We stabilized him. Started emergency dialysis, but he told me later, I had no idea throwing up could mean my kidneys were dying. And that's exactly the problem. We don't connect the dots. We think nausea means stomach issues. We think vomiting means food poisoning. We don't think kidneys. But your kidneys affect everything. And when they fail, the symptoms show up in places you'd never expect. Warning sign number 5 is shortness of breath. And this is the one that sends people to the ER thinking they're having a heart attack. Here's what's happening. When your kidneys fail, fluid backs up. It has nowhere to go. So it goes into your lungs. This is called pulmonary edema. You feel like you can't take a deep breath. You feel pressure in your chest. Lying flat makes it worse. At the same time, kidney failure causes anemia. Your kidneys produce a hormone called erythropoietin that tells your bone marrow to make red blood cells. When your kidneys fail, that hormone drops. Your red blood cell count drops. You're not getting enough oxygen to your tissues. So you're struggling to breathe and you're also not getting enough oxygen. It's a terrifying combination. Patients describe it like this. I felt winded just walking across the room. I couldn't lie down without feeling like I was drowning. I needed 3 pillows just to sleep. Research shows that about 60% of patients with acute kidney injury develop fluid overload that affects the lungs. And it can happen fast, within 24 to 48 hours. There was a woman named Diane. She was 72, diabetic, a little high blood pressure, nothing alarming. One evening, she felt short of breath. She thought maybe it was anxiety. She'd been stressed about something, By the next morning, she couldn't lie down without gasping for air. Every breath felt like work. Her daughter took one look at her and drove her to the hospital. They did a chest x ray. Her lungs were completely full of fluid. Her heart was struggling to pump against all that pressure. Her kidneys were barely functioning. They admitted her to the ICU, started diuretics to pull the fluid off, began dialysis. She survived, but she was hours away from respiratory failure. And here's what broke my heart when I talked to her later. She had all the other signs too: fatigue, swelling in her legs, nausea. She'd been feeling off for 2 days. She just didn't realize it was all connected. She thought the fatigue was just aging. The swelling was from sitting too much. The nausea was from something she ate. She didn't know her kidneys were dying until she couldn't breathe. Let me tell you 3 more warning signs. These are less common, but when they show up, they're critical. Warning sign number 6 is confusion or difficulty concentrating. When toxins build up in your blood, they affect your brain. You might feel foggy, forgetful. You might ask the same question twice. You might struggle to follow a conversation. Family members often notice this before the patient does. One daughter told me, "My dad kept forgetting what he was saying mid-sentence. I thought maybe it was dementia. The ER doctor said it was his kidneys." When they treated his kidney failure, his confusion cleared up completely. Warning sign number 7 is itching. All over your body. Relentless itching, especially at night. No rash, no visible cause. Just this intense need to scratch. This happens because kidney failure causes a buildup of phosphorus and other minerals in your blood. Your skin starts to itch from the inside out. Patients scratch themselves raw and have no idea why. If you're itching everywhere and there's no explanation, and you have any of the other symptoms we've talked about, get your kidney function checked. Warning sign number 8 is high blood pressure that suddenly becomes uncontrollable. Your kidneys regulate your blood pressure. When they fail, your blood pressure can spike dangerously, even if you're taking medication. If your blood pressure suddenly jumps 20 or 30 points and won't come down, your kidneys might be involved. Now, here's the most important thing I can tell you. You don't need all 8 of these signs to be in danger. Even 2 or 3 together are enough to warrant urgent medical attention. Let me give you the combinations that terrify me as a doctor. Combination number 1, fatigue plus swelling plus reduced urination. This triad means your kidneys are struggling to filter and your body is retaining fluid. This is an emergency. Combination number 2, nausea plus confusion plus shortness of breath. This means toxins are affecting multiple systems. You're likely in acute kidney failure. You need to go to the ER immediately. Combination number 3, sudden uncontrolled blood pressure plus any other sign. This suggests your kidneys have lost the ability to regulate your blood pressure, which accelerates damage to your heart, brain, and other organs. Here's the truth most doctors won't tell you because we don't want to scare people. Acute kidney failure can happen in 24 to 72 hours. Sometimes faster. One day you feel fine. 2 days later, you're in the ICU, but your body tries to warn you. It always does. The question is, are you listening? Let me tell you who's most at risk, because if any of these apply to you, you need to be hyper vigilant about these warning signs. You're at higher risk if you're over 60. If you have diabetes, especially if your blood sugar isn't well controlled. If you have high blood pressure. If you have a family history of kidney disease. If you take NSAIDs regularly, ibuprofen, naproxen, aspirin, those can damage your kidneys over time, especially if you're dehydrated or take them every day. If you take certain blood pressure medications, ACE inhibitors, or diuretics, those are usually protective, but in certain situations, they can stress the kidneys. If you have heart disease, if you're frequently dehydrated, if you've had a recent infection or illness, if you have an autoimmune disease, all of these increase your risk. Here's what scares me. You can have chronic kidney disease for years and not know it. Your kidneys can lose up to 75% of their function before you feel anything wrong. They compensate, they work harder, until one day they can't anymore. That 48-hour window we've been talking about, that's not when the damage starts. That's when the damage becomes undeniable. The real damage has often been building quietly for months, sometimes years. So what do? First, know your numbers. Ask your doctor for a creatinine and GFR test. That measures kidney function. Get a urinalysis to check for protein or blood in your urine. Make sure your blood pressure is under control, ideally under 130 over 80. If you're diabetic, keep your HbA1c under 7%. If you're over 50 or you have risk factors, get these tests at least once a year. If you have diabetes or high blood pressure, every 6 months. Second, hydrate properly. Your kidneys need water to function. Aim for 6 to 8 glasses a day, unless your doctor tells you otherwise. Dehydration is one of the fastest ways to trigger acute kidney injury. Third, be careful with medications. NSAIDs like ibuprofen can damage kidneys, especially if you're dehydrated or taking them every day. If you need pain relief, talk to your doctor about safer alternatives. Fourth, control your blood pressure and blood sugar. These are the two biggest drivers of chronic kidney disease. If you manage nothing else, manage these. And fifth, trust your gut. If something feels wrong, if you have that combination of fatigue and swelling and nausea, don't wait. Don't tell yourself it's nothing. Go to the ER or call your doctor immediately. Kidney failure is reversible if you catch it early. But once you're in stage 5, once you're in complete failure, your options become dialysis or transplant. And I don't want that for you. Let me tell you what happened to Margaret, the woman I told you about at the beginning. She spent 3 days in the hospital. We gave her IV fluids, controlled her blood pressure, managed her electrolytes. Her kidney function slowly came back. She didn't need dialysis, but it was close. When I saw her 2 weeks later for a follow-up, she said something I'll never forget. She said, "I thought I knew my body. I've lived in it for 67 years, but I didn't know this language." And that's what this is really about. Your body has a language. It speaks to you through symptoms, through sensations, through changes you might be tempted to ignore. When it comes to your kidneys, that language is quiet, it's subtle, but it's there. Fatigue that feels different, swelling that won't go away, nausea that lingers, urine that looks wrong, shortness of breath that makes you pause. These aren't just annoyances. They're not just signs you're getting older, they're warnings. And now you know how to listen. If this video helped you, please share it. Send it to your spouse, your parents, your friends, because kidney failure doesn't just happen to other people. It happens to people like Margaret, like Robert, like Linda, like George and Diane and David. It happens quietly, but it doesn't have to be a surprise. Leave a comment and let me know, have you experienced any of these warning signs? What did you do? And if you want more videos like this, real medical information that could actually save your life, subscribe and turn on notifications. Take care of yourself and take care of your kidneys. They've been taking care of you your whole life. Now it's your turn.